What were my CML treatment side effects?
And how did we deal with them?
Stay tuned and find out.
Hi, I'm Amy.
And I'm Steven. I was diagnosed with chronic myeloid leukemia, CML, in 2011. I experienced a lot of different side effects from my treatment, which was an oral chemo pill called Tasigna, or Nilotinib. I was on these pills for over 8 years. But before I started Tasigna, I was prescribed Hydroxyurea, which killed the excess white blood cells in my body. This brings the white blood cell count down to a normal level, which then means I can start taking the Tasigna. When the white blood cells die, they release uric acid, which can cause gout.
So to prevent the gout, Stephen had to take a second drug called Allopurinol. So he had to take 11 pills a day for 5 days, total of 55 pills.
Yeah, that was not fun. I mean, at some point I was losing count of how many pills I was taking a day, and just figuring out how to take all those pills throughout the day was draining enough, along with dealing with a new cancer diagnosis. I did deal with a little bit of fatigue that first week, but the week went by so fast that some of it may have just been due to the stress and of everything that was going on and the newness of it all. I took my Tasigna pills every day for over 8 years. In the beginning, I was on the 200 milligram dose. I had to take 2 pills twice a day, so 4 pills total a day, or 800 milligrams.
So here were some of the side effects that Stephen experienced. First of all, there was fatigue.
Yes, for the first few weeks I dealt with fatigue. My work was nice enough to let me have an office that had a couch in it, and so I could go in there and take a nap, which I did every day for about an hour. I probably did this for about 2 or 3 weeks as I was getting used to taking the Tasigna pills. Once I got used to it, though, the fatigue did go away, and I no longer needed to take the naps, which was a good feeling.
There's also a QT prolongation risk.
So this is related to the cardiovascular components of the body. I'm not going to get too technical here, but the drug can increase the measurement, which can be dangerous. So to check for that, I had to have several EKGs. I had one at diagnosis, one a week after starting the drug, and a third one about 3 months into taking the drug. What they want to do is make sure that the QT number does not get too large, and if it does, then they would have to withhold the drug. Fortunately for me, it increased a little bit in the beginning, but then it kind of normalized back to what it had been, so it was not a risk.
Stephen also dealt with low white blood cell counts.
This happened early on in my treatment. Along with the Hydroxyurea, which pushed down the white blood count, the Tasigna can also lower white blood cell count. So in the first few weeks when I had Hydroxyurea and then the Tasigna, my white blood count did drop a little bit. It got to about 2. The normal range is 4 to 11, and mine got to about 2, and they came very close to actually withholding the drug for a little bit, but didn't have to. And after about the second week on the drug, it started to go back up again, and then I never had an issue since.
Stephen also had thinning hair on his arms and his head, and the hair on his head had like a coarser feel to it. We didn't do anything about that, really.
Yeah, those are cosmetic, and it wasn't really an issue. I didn't lose my hair. You wouldn't really notice, especially in my head, that I'd maybe lost some hair, or in my arm. So it was sort of a non-issue for me, just something that I observed but didn't really care about.
Stephen also dealt with rash at the very beginning of his treatment.
The rash was on my arms and stomach. It wasn't itchy. It wasn't really red. It looked more like goosebumps, especially on the stomach. And it went away, I think, pretty quickly. I think it came back at times, but it would just sort of come and go and not really be an issue. But there was no drugs I needed to take. It just, an impact on my skin.
In the beginning, he also felt kind of like he had a restless leg syndrome.
This really impacted me at night, where I couldn't get comfortable sleeping. It felt like there was just ache in my leg, and no matter what position I was in, I just couldn't get comfortable, so it really impacted my sleep. I've done some research and actually tried putting soap in the bed, which is one of the recommendations. I don't know if that really helped. Maybe it did. Maybe that was mental. I think I also took an Epsom salt bath, which was relaxing, but in the end I realized that drinking a lot of water helped the most. So I made it a point to have a water bottle with me everywhere I went, in the office, out and about in town. I was always drinking water, and that really helped with the restless leg syndrome and got me back to normal.
So this is something that's ongoing. Stephen deals with a lot of skin infections.
Yeah, I have to be super vigilant about it when I get a cut. We have 2 cats, and so any little nick can really get infected if I don't take care of it. So I've learned that anytime I nick myself, whether it's with my cat or scratch myself somewhere else, I need to clean it. I need to put ointment on it. I need to bandage it, and I need to monitor it for a couple of days just to make sure it doesn't get infected. Ever since being diagnosed, I seem to be at a higher risk for those kind of cuts getting infected.
Stephen also dealt with higher glucose for the first year or 2. This is a known issue that the drug causes.
But ultimately, it wasn't high enough for my doctors to worry about it. I then decided to start having my lab work fasting. It wasn't a requirement, but I realized that if I fasted before my labs, then my glucose would be normal.
One of the bigger issues that Stephen dealt with was a higher bilirubin count. Bilirubin is a liver enzyme.
So the normal range of bilirubin is about 0.3 to about 1 or 1.3. And ultimately, my bilirubin got as high as 2.5 to 3. And they came close, I think, to stopping the drug, but they started doing a breakout of the direct and indirect bilirubin and realized that most of the increase was due to indirect bilirubin, and the direct bilirubin was more important. That was always normal. But eventually, after about 3 years on the treatment, when I got to about 3.5, they did withhold the drug for a little bit, for about a week, and that's when I went to the lower dose, to a half dose, and that brought my bilirubin down a little bit. My PCR was still coming down. My leukemia was still going away even on the lower dose. I think they really pushed the first few years to keep me on the drug as much as possible to really attack the leukemia. And as I said, it wasn't until after 3 years or so that they were comfortable reducing my doses to deal with the side effects.
Stephen's currently in treatment-free remission, so yay. He stopped taking Tasigna in 2019, but there's still some minor side effects, even getting off the pill.
I was fortunate that I didn't experience many withdrawal side effects from stopping the Tasigna. I think it helped that we slowly lowered the dosage of my drug over time. As a reminder, we started at 800 milligrams, then went down to 400, and then down to 300 over the years. That helped, I think, a lot to help me wean off the drug and not deal with as many side effects from withdrawal.
And the last 6 months, you were just on the 150.
Oh, that's right, yes.
Once
and then
a
it was
day.
150.
Mm-hmm.
So really from 800 down to 150 over the 8 years.
The main withdrawal symptoms that Stephen's care team have seen is muscle soreness. This usually happens within the first few weeks of stopping the drugs.
I didn't experience this right away, but 4 or 5 months after stopping the drug, I started having aches in my hand, kind of like arthritis. This did go away after a few weeks.
And Stephen's bilirubin, which was always elevated when he was on the drug, that went back down to normal once he got off, so that was really exciting.
My hair became fuller again as well. However, I still get skin infections easily, even after stopping the drugs. And recently, I've been dealing with my stomach making noises, like squeaky sounds, especially at night. I think that's something to do with what I'm eating, but haven't been able to figure it out just yet.
Mm-hmm. So in closing, we're here to support each other and learn from each other, and we're all part of Team Heal, and we want to hear from you.
Our question of the day is, what side effects did you have from your treatment? Comment with your answers below and we'll write back.
Hit the subscribe button and the bell to join Team Heal. We all need teammates to support us in living a healthy lifestyle.
We're here to coach cancer survivors and caregivers on how to live healthy lives, and we want you to be part of our team of healing.
We're Amy and Stephen from the Heal Every Day Together channel. Check out the link below to our website to find out more about our program for cancer survivors and caregivers.
Thank you for joining us today.
Together we heal.